Hello and welcome to Spine Care Fitness. I'm Dave.
And I'm Laura.
And we're here to teach you how to become your own personal body mechanic so that you can fix yourself.
My name is Laura Fields. I'm a sports medicine physical therapist, and today we're going to learn the giant L and crossover. What the giant L means is the hamstring attaches to the pelvis, which attaches to the lumbar spine. And if one side is tighter than the other, or you have just tight hamstrings and you know who you are, when you go to stand up, something's got to give, and it's not your knees. It's the tighter muscle pulls down on the pelvis, and that flattens out your spine. It takes out this protective lordosis. So what you need to do is get both hamstrings that attach right to this base here balanced. You need both hamstrings to be the same. So now we're going to get on the floor and actually do this and make both hamstrings even to make your frame the same. Feel free to get on the floor with us. Okay, so now we are going to teach the techniques of the spine tune-up, specifically for the giant L and the crossover. We call it these names because that's what it looks like to me. You can give it your own name if you want, but this is just the names that we've coined. Okay, so as we said, the hamstrings go from the back of your knee all the way up to your pelvis, and if one side is tighter than the other, it's going to yank you down and pull you to that side, and that's going to cause inflammation and pain, friction. So this is how you fix it. Take with the knee straight. I want you to pull up your toe, point your toe, and lift the whole leg. Your goal is to get vertical. Have it point straight to the ceiling. If you cannot get here and your knee's straight because you're just too tight, here's a baby step. Bend the knee. Now lift it all the way up. Good. Some people use ropes, towels, belts, things like that to put over your leg. I'd rather you use your muscle, use the quad to straighten out the knee, make the quad get in on work. Don't try to reach with your hand because your arm is not long enough to reach your leg, especially if you have a tight hamstring. Also, your arm isn't as strong as your quad. This is the biggest bone of the whole body, and this quad is wicked strong. Let it work. Let it do its job. Okay, so once you get vertical like this, then you can gradually let this leg go down. Good. In order to now see what side is tighter, bring it down, now bring up the other side. Lift it up, nice. So what side is tighter?
I think the left is a little bit tighter.
Okay. All you want is your knee straight. A lot of people cheat by bending the knee and bringing up the hip more, and they're going, yeah, I'm good, I'm stretching hamstring. No, you're not. The only way to stretch
I used to do that.
Stretch the length and lengthen the hamstring so that you're not at risk of rupturing the hamstring or hurting your back is straighten that knee and feel that burn. You will feel the pull. Now this is what some athletes do to help give their brain something else to think about while they're giving the hamstring time to lengthen. And cross it over a little bit. You take your hand, hold it like that, bend your elbow a little bit, put your hand over your chest, and now do some stomach crunches. Good. You're feeling the burn, but it's not as intolerable because now your brain is focused on doing a stomach crunch. You can pull this toe down, feel the burn, love the burn. That burn is the tendon is lengthening, scar tissue is releasing, and the muscle is lengthening. And once both sides feel that have the same length, you've eliminated the torque and pressure off your low back. Good. Now do the other side. Just a little crossover. Go ahead and pull your toe down, because when you pull your toe down, then you're activating the calf and the Achilles, and you're just fixing things. The IT band, all the soft tissues that connect from your knee all the way to your low back and hip are being taken care of by doing this one little maneuver. It's great. Good. All right, now we're going to cross it all the way over. Now this is what's going to give rotation to that lumbar spine. If you hear, as you cross over, don't worry about it. As long as it's not a sudden movement, a ballistic movement, you'll be fine. Okay, so you're going to cross it over, take your opposite hand, and let it steer that leg down until you can shift your hips underneath you. Good. And let gravity feel the pull. What's happening, their joint is covered by a capsule, and you're stretching that capsule. And that's great. That's what you want to have happening. You want to open up that capsule so that you have freedom of movement and there's no friction going on. When it's tight, there's friction, and that's going to cause inflammation and pain. Now go ahead and do the other side. I'm going to get out of the way. Somebody's going to kick me right now. So lift up and cross over. Awesome. And feel the stretch. It's okay to feel that burn. Good. Come up. Just do both sides. Do it one more time. Spend a little bit of time in the giant L. Feel that hamstring. The side gets tighter, hold it longer. The research says 30 seconds, some research says 60 seconds is needed to lengthen, give the muscle tissue time to lengthen. And so, at least 30 seconds. Okay, good. Thanks for coming to see us. I hope we helped you out.
You can check out our blog and other videos at www.spinecarefitness.com. Feel free to leave a comment there. We'd love to hear your thoughts and any requests you might have for videos that we don't have yet. Have a great day, and thanks so much for stopping in.
Bye-bye.
For even more great videos and resources, subscribe to our newsletter by visiting us at www.spinecarefitness.com. And just as a thank you for signing up, you'll get access to our subscriber-only video, The Back Attack Negotiator.